Hi, my name is Mariam Aziz. I am a sexual health educator and I'm completing my training as a psychosexual and relationship therapist, which is a long form of saying sex therapist. Sex therapy and couples therapy, people usually don't think of them as one and the same, and they're not, but they're very related. So sex therapy is the form of therapy that serves clients, whether individuals or couples, who are experiencing sexual difficulties. And that can range from anything like difficulty obtaining an erection or maintaining it for a man, or pain on penetration for a woman, or difficulties orgasming. And these things aren't just physiological. They're often very related to what's happening in a relationship between the couple, but also for individuals with their own histories and backgrounds, and possibly histories of trauma, because sex isn't something that happens in a vacuum. And if that relationship is in trouble, it's unlikely that sex is going to be great for one or both partners. One of the most common sexual difficulties I see, and a lot of sex therapists in the region see, is vaginismus in women. Vaginismus is the recurrent inability of a woman to allow the penetration or entry of a penis into her vagina, despite her expressed interest and desire to do so. So this is something consensual, something the woman wants and desires, but is unable to do. And this is usually accompanied with a lot of anticipation of fear, anticipation of pain, or realized fear and pain. And this is usually accompanied with tensing or contraction of the pelvic floor muscles. Now, this is one of the most common sexual difficulties that I see with women in the region. And I don't think it's very difficult to understand why. We lack formal sex education, so often there are myths that pervade our society, but also there's a lot of shame when it comes to sex. And so we see a lot of women coming with vaginismus that is not rooted in physiological issues. Then what we're working with is something psychological that is rooted in emotion and ideas, and that manifests itself in the body. A woman will come to me alone, and very quickly I realize, okay, we're going to have to put the sexual problem on hold for just a little bit, because the relationship you're describing to me sounds like a very unsafe relationship. Even just emotional lack of safety can be very impactful for a woman to be able to trust her partner, to be vulnerable. Then I'll suggest that she invite her husband or partner in to work on the relationships. Because if a couple can't communicate about general topics, it is very unlikely that they're able to honestly and vulnerably communicate about sex and their desires and their needs. And there's this idea that a woman who has desire or who is aroused, not a very good woman, you know? Like, why does she want that? Where does she know this from? And so these are fears that women have, even in speaking to their husbands about their sexual desires. So if that's the issue, if the relationship is what's causing the problem, we definitely go there first. And that's important because whenever I see any sexual difficulty, a very important question for me to ask is, what is the function behind the dysfunction? There's usually something that the woman's body is protecting her from. And that is really important to think about, because we don't want to just force sex onto a body that is protecting itself from something that's going on. It could be protecting the woman from an unsafe relationship. It could be fear of abandonment that's been built into her life from childhood, or threats of abandonment from her partner. It could be fear of pregnancy, for example, which is more common than I anticipated. Many women have never looked at their body, and I'm not just talking about looking at their vulvas, because sex is something we do with our bodies, and therefore we need to be comfortable in our skin. And we need to start integrating and becoming integrated beings. So a lot of what shame is, I think of it as hiding, right? And unfortunately, that is pervasive in our society, especially when it comes to sex, and especially when it comes to women's sexuality. And it plays a really big role in what we see being manifested in sexual dysfunction or sexual difficulties, especially for women. And so a woman who's been taught all her life that her value is in her purity, that her hymen breaking is the worst thing that could possibly happen. And that is the culture that these girls grow up in, into women who then can't turn on a switch and think of sex as something beautiful and pleasurable and intimate. And it also features within marriages. For example, when there's a mismatch in desire, when one partner has higher sexual desire than another, and sometimes it's not the man who has more desire than the woman. Sometimes it's the woman who has more desire than the man. And that can bring a lot of feelings of shame, both for the woman and for the man. Views of sex therapy in Egypt and in our region are slowly but surely changing. I think it comes from the idea that there is a problem and people need help. And going to a medical doctor with a sexual difficulty is a good first step for some people. It's definitely not the last resort. There aren't many of us, but I think our numbers are growing, and that is really great because the need is vast. And what's also really encouraging to me is that I'm seeing clients not just from one specific demographic, but from really all over. If I had a superpower, if I had a genie that would give me the power to change two things about sex and the way it's viewed in our society, they would be: one, that sex is about a man's pleasure, and two, that a woman's value is in her purity, virginity, hymen, blah, 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 blah.